Staying active only becomes more difficult the older we get. Our plates get stacked full of never-ending responsibilities, and taking time for ourselves becomes a rarity. It's a sad reality for so many, and one that's directly harming our health. In fact, Doctors Caitlin Mueller and Allie Thomas, both recreational therapists, believe that older adults need to be viewing time spent outdoors as a necessity, not a luxury.
Caitlin and I, when we're talking about this and, in the practice settings that we worked with, realize that there's this successful aging, but older adults can like and engage in more high and active engagement outside, and there are significant health benefits.
That's Thomas, an assistant professor in recreational therapy at Texas State University. Both her and Mueller, an assistant professor and program director of recreational therapy at Catawba College, recently published a paper in the Journal of Outdoor and Environmental Education. They compiled evidence from 20 databases and journals to see what research says about outdoor-based activity, specifically for older adults. Unsurprisingly, their research revealed that exercising in nature is super beneficial, something many of us can feel the effects of in our own lives. Teresa Gross, for example, has been prioritizing her outdoor exercise for years.
I had a neighbor across the street that I walked with for 15 years every day, 5 days a week. We were the postman. Rain, sleet, snow, cold, hot, didn't matter. So we walked. She bugged me for 10 years. Trace, why don't we bike ride? I wanted no part of it. I had a bad riding experience I loved it as a kid, but as an adult with Boy Scouts, I had a bad bike riding experience of 35 miles and my butt hurting so bad, I walked the bike back the last 2 miles. I walked it back. So I didn't want to do it.
Mueller and Thomas's paper stresses the importance of older adults finding an activity that they truly enjoy. That way, they're receiving the full mental and physical benefits, and they're more likely to make it a regular habit in their lives. And though bike riding wasn't a preferred option for Gross, she could be persuaded with the promise of a happy hour at the end of the ride. So the pair began a weekly 7-mile ride to a winery down the street. Word of their outing started getting out to other neighbors, and before she knew it, Gross had a group of 10 women riding together each week.
And it was always to a destination, because we always said we were riding for beer, riding for wine, riding for social time, because I really didn't care about the riding part. That was hard, and my legs hurt, and it's hard to breathe, but I wanted to get to the fun part.
Though she would have never guessed it at the time, Gross has happily become an avid bike rider. More than a decade later, her group has flourished into a large community of women who ride 3 times a week. The 7 miles that used to be a challenge now fly by as she leads the group on 30, 40, even 50-mile routes, though she's kept the happy hour tradition alive. And even with the increased distance, Gross has naturally realized what Thomas and Mueller's paper highlights, which is that it's important to meet people at their current ability level.
This idea of outdoor-based intervention, adventure therapy, it really lends well to being able to help a older adult thrive with regardless of their different situation, whether it is pre-diagnosis, post-diagnosis, meeting them where they are currently at.
We started out just real intro level, simple, dumbed down. But as we excelled and we started having real bike riders going on roads and doing more like 40-mile, 50-mile, 60-mile rides, well, that doesn't work for everybody. I've still got girls I have a 75-year-old who rides with us. And, she's more comfortable with 20 miles.
But instead of booting her from the group, Gross has modified the rides to accommodate as many levels as possible. She plans out the routes so that people who want to ride a lesser distance know when and where to jump in.
So you can join for all 30 miles or just take the first 10 and the second, or just do the second 20. It gives people a lot of time options with their schedule as well. If they can't get there till the second phase of the ride, or if they just really want to knock it out.
Both the outdoor exercise and social network this group offers helps promote successful aging. Thomas and Mueller realized that the evidence they compiled could be broken down into 3 components of successful aging. The first theme is prevention, which encompasses both disease and disability.
By engaging in mountain hiking or doing mountain biking, the results of our study showed that older adults were preventing onset of different things, diagnoses, even just more of that like negative mindset. There were things that were being prevented.
The second branch is retention. This includes keeping both good physical and cognitive functioning. And again, it's all about meeting the person where their abilities currently are.
So whether, they already have Parkinson's, but now they're using mountain biking as a way to be able to work through different symptoms, to be able to maintain their current health, that's a really big deal. And then the third part, which was evident in all studies, was the active engagement. And so being able to have the older adult do something that they're enjoying, but that they're also doing it very actively, and they are reaching good health outcomes because the thing that they're doing is active in nature.
The pair believes this successful aging perspective sets their paper apart and offers a clear roadmap of how nature and community can benefit older adults.
For some of our studies, it was that like social piece. So having other people that also enjoy mountain biking or enjoy backpacking, doing that together, and being able to see that there were health outcomes purely because our older adult participants were active.
For many people, a lack of time spent outdoors isn't a conscious choice. Life gets busy, and all of a sudden, the only walking you do is from the car to your front door. It's so easy to slip into this pattern, which is why having it be a part of your schedule, like Gross's weekly rides, helps keep people accountable and committed.
I had somebody just tell me last week it was 40 degrees and we went on a bike ride and I had 6 girls and they're like, I would not be on my bike today if I didn't have a designated time to be there. My girlfriends are going to be there as well, and I would get to see them. We would have our social time. We would get our exercise. So I think accountability is huge to make you come out and actually get exercise in. In fact, you're going to have the social part is the hugest part.
You could just be present and mindful in that outdoor space, but then that physical activity, increasing that heart rate, having those social conversations and connections, and not being confined to this wall that is your everyday. There is a ton of research out there to support for all ages. It is extremely beneficial.
Sadly, there are various barriers to getting out and active for older adults. The first reaction for many is to let the obstacles stop them from doing the activity they want. However, Thomas says we need to rewire our thought process to instead come up with a solution that may look a bit different than what we want, but is still fulfilling.
And so just taking things and saying that outdoor is not for older adults, that's not accurate. But how we do that can look a little bit different. We need to stop saying it's not for this person or that person. How can we allow all these individuals, if that's the right leisure for them, then we need to make these extra considerations for them. And to say that they're not, that successful aging is an important practice instead of just saying they're older and can't do. It should be what can they do, because we want to keep them physically and cognitively active.
Gross has added this philosophy into her own rides to make sure that all women who want to join are able to, regardless of their physical capabilities.
Even the girls who maybe are in a situation they can't ride right now, they've been injured and they're healing and they're coming back, they can still show up for happy hour. They don't have to get on their bike. They can still see their girlfriends. And I make that very clear in my e-blast. You don't have to have a bike. Come out and hang with us. Share a cocktail. And we have girls that will do that. It feeds your soul.
Since Thomas and Mueller have been able to document the clear benefits of outdoor activity, their next step is to dig deeper into the type of nature people are exposed to. One main idea they're excited to explore is the added benefit of having access to blue and green spaces.
So if you live near water, or again, like if you can see a pond from your office window, that research is showing that there are health benefits to that. So the studies that were in our scoping review, they weren't all super clear on, when they were mountain hiking, how many lakes did they walk by? Was it during winter when everything was kind of dead, or was it during summer when everything was green? And, I think that's some areas, especially for the older adult population that, wants to successfully age. They want to continue to be active. What are some of the positive parameters that, again, people like us that are trying to like facilitate these programs, therapy sessions, even just, doing everyday education through senior centers? How can we understand that, if there's a lake or if there's a stream or if there's a big open grassy meadow, there may even be more health outcomes because research is showing that having access to those green and blue spaces really does matter.
Which means that prioritizing your time being active outdoors can help you take control of your aging. You can find more information about Teresa Gross, Dr. Caitlin Mueller, Dr. Allie Thomas, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.